Hey everybody, Karen Anderson here with Aortic Hope, and this is our pre-recorded week in review. Why is it pre-recorded? Because I got stuff to do. I got doctor's appointments today, so unfortunately I cannot be live with you. But you're seeing this, and if you're seeing it, it's kind of like being live. So I'm going to ask you, click like, click subscribe, click that little bell so that you're notified when our videos pop up, when we go live, and we do it for so many things. And we're going to have live events coming up pretty much on the regular. We've got Qigong, Aortic Kitchen, live speakers, live Survivor Series, so many options in this community and integration of your hobbies and things you like to do. We're just offering a lot of stuff. Let's just leave it at that. So it's just me pre-recording, which is when I tend to screw up the most, right, Joshua? I don't know why that is. Why is that? I don't know. I think I do better live. So
I think you're
we'll
much
see.
more relaxed live.
We're just going to pretend it's live. All right, let's go. Let's jump right into it. Let's get it started with Medical Monday. So, I'm wondering how many of you realize that watching your favorite sports team can actually spike your blood pressure. Watching The Walking Dead could probably spike some of your blood pressure. Watching reality TV, it spikes my blood pressure. So there's so many different ways that a blood pressure can just spike, or your messy desk, or for some people it's walking into a room and their bed's unmade. There's just a lot of different things that can create anxiety and kind of raise your systolic blood pressure. That would be your top number. Life is just full of so many hypertension hijinks, basically, is what they're saying. So even a hearty laugh can momentarily boost those numbers, although it's all in good fun. Let's not forget the sneaky salt that's hiding behind your healthy smoothie or your healthy food. Surprise, surprise, blood pressures are on the rise. And it's funny, I took a look at like lean cuisine and all of these smart, healthy foods. They are not healthy. Have you checked out the sodium content in one of those, like Salisbury steak or ginger honey Szechuan chicken? It's not good. It's not good. Don't eat it. Just saying. It's got a lot of salt. Here's a few other culprits that can actually be the cause of increasing your blood pressure, according to an article in AARP. So, first off, it could be sleep apnea, a sleep disorder in which a person stops and restarts breathing several times throughout the night. This can actually cause a bump in your blood pressure, and it's becoming increasingly common in the United States as more Americans struggle with being overweight, says Dr. Donald Lloyd Jones, chair of the Department of Preventive Medicine at Northwestern University Feinberg School of Medicine and former president of the American Heart Association. On top of sleep apnea can be just a simple, unpredictable sleep schedule. It's not just apnea during your sleep cycle that can actually cause your blood pressure to go through the roof, but people who don't get at least 6 hours, anywhere from 6 to 8 hours of sleep, can actually have elevated blood pressure. And this is from Dr. Luke Laffin, who we had here as a guest on Aortic Hope. He's the co-director of the Center for Blood Pressure Disorders at the Cleveland Clinic. So just think about that. I mean, I am, for one, a big, big supporter of like that 8 to 10 hour sleep. It makes me very happy. But I'm like many of you, and I know it's many of you because I'm up at 1:30, 2:30, 3 a.m. looking at all of you thinking, why are you all up? You're all having the same issues that I'm having, which is a degree of insomnia, racing minds, so many thoughts, and we just can't seem to quiet our minds. And I don't have sleep apnea, but I'm sometimes have that irregular sleep schedule, and it does mess around with my blood pressure sometimes and my anxiety and my thought processes. So trying to quiet your mind and get your environment prepared for sleep, which means turning off the phone before you get into bed, is probably going to be something that would help out that situation. Here's another interesting one that can increase your blood pressure: holding it when you got to go to the bathroom. So when you have a full bladder, but you're waiting to urinate until the next rest stop or commercial break on your TV, for those of you that still watch TV that have commercials, your body actually increases your blood pressure. A full bladder will raise blood pressure about 10 to 15 points, Dr. Laughlin said, which I had no idea, no clue, never heard of that before. That's why he and his colleagues encourage people to urinate before they measure their blood pressure, particularly if they're doing so to monitor the medications they're taking at home. So that's interesting because I've never had a physician say to me, "Do you need to use the restroom before we come in and I take your vitals?" I'm curious now to know, what kind of difference it would make. But I guess it's logical because if you think that we're on water pills sometimes to release excess fluid from our body to ultimately reduce blood pressure, then I guess it kind of makes sense, right? So maybe that's something that you can add to the list of things you try to do before taking a blood pressure. Is just go to the bathroom, then sit and relax. I don't know. I found that very fascinating. Here's another one that can rise, it can raise. It will raise your blood pressure, and that's air pollution. So researchers reveal that exposure to fine particulate matter or air pollution, like what you'd find from a car exhaust and burning or fuel burning or what have you, for example, coarse particulate matter air pollution, like dust from roads and construction sites, that can actually boost your blood pressure in adults. The link has also been established in children. So I guess if this is one of those that you're really susceptible, and I guess it makes sense. If it's something that causes you sneezing or any type of reaction, allergic reaction, well, that's inflammation. That's why you're sneezing. You're trying to get rid of stuff that's in your body that can raise your blood pressure. But there are cars now that have this intuitive computer component that will switch the intake from outside to circulating inside air. So you may want to look into the setting in your car if you have one of these new cars with these new features. Or you know what? We're in the day and age of masks. Like, I hate having allergies. So when the pollen count is up, I'm wearing a mask outside. It's not really because of COVID. It's because I don't like feeling like I'm walking around with a cold every day. And I don't now want my blood pressure to go up if this is clearly a possible participant in that. So just my thought on that one. All right, let's see what else we got. Oh, I just went off. Okay. So we've got black licorice. Black licorice. Okay, first of all, in my opinion, disgusting. That's just my opinion. I think it's gross. And now I feel validated because this is not a trick or treat. Black licorice, we're talking the real deal, not just licorice flavored candy. It actually can be a health hazard, and not just because of its sugar content. So the candy actually contains this compound called, I'm going to guess it's called glycyrrhizin because I can't say it. Glycyrrhizin. Sounds good enough. It's derived from licorice root, and which can actually cause the body to hold on to lots of salt and water, which will drive the blood pressure up. So if you're gonna do licorice, stick with red. It tastes better too. All right, another well-known culprit for potentially increasing your blood pressure is alcohol, your alcohol consumption, which is so confusing because it's often repeated that alcohol, like a glass of wine, is really good for your heart, but it can also send your blood pressure soaring, both in the short term and in the long term. Dr. Lloyd Jones explains that while alcohol initially relaxes the blood vessels, those vessels will start to constrict once the liver metabolizes it. So blood pressure can remain at this higher than normal level during the day after imbibing. Never heard of that word, but there's a word for you. And if drinking too much becomes a pattern, well, your blood pressure numbers are going to go up, and that's going to become a pattern too. Something to think about.
That
Drink for
word,
thought.
that word is
Yep.
imbibing. And you
Imbibing.
have heard of that word before.
Well, if I've heard it, it didn't get retained because there was something more important that I kept in as that imbibing went in. It's colloquially. So I'm not interested in retaining it. But imbibing. All right. What was the other word? What was the other word? The
Oh, you'll have to scroll back. Glycyrrhizin?
That's good. You're good.
I don't know if
Gly
that's real.
glycers Nope, we're moving on. Lack of fruits and vegetables, everybody. Lack of fruits and vegetables can be another potential cause. Diets are pretty simple. We've been eating fruits and vegetables since the dawn of day. So if you decide to eliminate fruits and vegetables, you could potentially cause your blood pressure to go up. And the reason is too much sodium is a long established catalyst for hypertension. We know this, but a diet rich in produce can actually help counter the effects of sodium, thanks to the potassium that's found in many fruits and vegetables. Salt increases blood pressure, potassium decreases blood pressure. Now, I will say, so many of us are on medications that already have an element of potassium added. So before you go crazy adding all kinds of fruits and vegetables full of potassium, before you eat a bunch of bananas every day, talk to your physician, because you also don't want to have astronomical levels of potassium in your bloodstream too. So you might want to just talk to somebody about that. But uh, so salt, we know, increases blood pressure. Potassium will actually decrease blood pressure by causing our bodies to release that sodium, says Seamus Welton, Dr. Welton, an assistant professor of medicine at Johns Hopkins Medicine Division of Cardiology. So men should be aiming to intake 3,400 milligrams of potassium per day, and women need about 2,600. So something that's food for thought. All right. Your social life or lack thereof can actually increase your blood pressure. As a species, we are not meant to be without other people, says Conklin. Conklin's the last name. Sorry. An assistant professor at the University of British Columbia. I apologize for butchering your name, but if you're socially isolated, uh, it's going to raise the levels. It's going to raise your cortisol levels and put you in this potential fight or flight response. A study Conklin conducted of 28,238 adults between the ages of 45 and 85 found that women, being single, having limited social activity for being part or limited participation in being part of a smaller social network, was actually linked to having higher blood pressure. So if you find that your social network is small, join our hangouts on Thursdays at 2, because it's not small there. And maybe you're going to feel this boost in cortisol levels and you're going to feel really happy. And it might lower your blood pressure. Never thought of that as a link. Learning something new every time we put these posts up. Just saying. I'm not a doctor. Don't know if it'll happen, but I know it makes a lot of people happy, and you can join on Thursdays at 2. All right, common medications. If you have a headache or joint pain, be mindful of what you reach for when you head to the medicine cabinet. Non-steroidal anti-inflammatory drugs like ibuprofen or Advil, naproxen or Aleve can raise your blood pressure. And so the regular use of acetaminophen, Tylenol, according to new study published in the Circulation, the Journal of American Heart Association. So we know this already. Don't always reach for Advil or Aleve. Like, mix it up with Tylenol. But then I know that Tylenol can cause problems for people with their livers. So you know what you do? You talk to your physician. These are one of those times where you can say, hey, this is what I heard in an article. I'm coming to you to talk about the situation. Added sugar. Since we've been talking about food, adding sugar can actually potentially increase your blood pressure. So when we eat sugar, our bodies can release insulin to help clear the sugar from the body and get it into the cells where it can be used for energy. But insulin itself tends to drive up blood pressure in many people, Lloyd Jones said. So if you're interested in eating a lot of added sugar or simple starches, you're having these more intense and longer bursts of insulin, which will raise your blood pressure. Added sugar is common in soft drinks, cakes, and cookies. These are some of my favorite things. Some yogurts and breakfast cereals can also be high in added sugar. And I am proud to say that I, for 50 some years of my life, loved a good bowl of Cocoa Krispies or Lucky Charms, or what's the other one? The Captain Crunch with the berries, because those are really good. I did. And then one day I didn't. I just don't. I do like cinnamon life cereal, but I don't eat cereal very often, but I do love milk because I am a baby cow. And we have talked about this before. I am not a baby soybean. I am not a baby almond. I'm closer to being a baby cow. And I love skim milk. I love a cold glass of skim milk. So having it with a little bit of cereal makes me happy, but once in a blue moon. Like if I don't feel like doing dinner, I might just do a little bowl of cereal. But I try not to get things that are high, high, high in sugar. Like I love a good bowl of Cheerios. Like just throw some strawberries on it. That's the sugar that I need. That's what I'm craving. But I love eating some of those toasted oats. But that's me. Don't do me. Don't do what I'm saying. Just do what you want to do and talk to your physician. But I have noticed a difference in now that I've stopped all that sugary, sweet, gross stuff that had no value whatsoever. I've noticed a difference in not crashing after breakfast, which I would do often, get very tired, and I don't feel spikes in my blood pressure. So, all right, the last one I think here. Nope, next to last. Smoking. We say it all the time. Another reason to kick the habit is that smoking, it is a proven risk factor for heart attack and stroke. And it is known to be a contributing factor towards developing an aneurysm. So it's going to mess with your blood pressure. According to the American Academy of Physicians, nicotine is really what is to blame, and it causes the blood vessels to narrow and the heart to beat faster. And that actually makes your blood pressure get higher. So, if you look at the monitoring, it's clear that the blood pressure of smokers over a 24-hour period is higher than that of non smokers. It just, it is. It's more than what Bird just said in this article. It just is what it is. Okay. Try smoking cessation. Talk with your doctors about whatever it is you need to do to kick that habit. If I can kick Lucky Charms and, and Captain Crunch, which was hard, it took a while, then you should at least try to kick smoking. And the other thing that can cause your blood pressure to go high would be if you have another condition, right? So the overproduction of a hormone that is called aldosterone can cause high blood pressure and even make it more difficult to control with medication. And Bird says that people who haven't had any luck in lowering their high blood pressure with multiple medications should talk to their doctor because there's a reasonably good chance that you have a condition that might be called primary aldosteronism, aldosteronism, or something like that. The condition is often missed, Bird says, but medications can treat it. And I would also add to having another condition that if you have an inflammatory condition like lupus, rheumatoid arthritis, Crohn's or colitis, ankylosing spondylitis, many of these itises that cause your inflammation markers to rise, does give you the potential for having an increase in your blood pressure. Doesn't mean it's going to happen. Again, I'm not a physician. These are just things that I have heard in the medical community. So you might want to talk to your physician about how can I track my blood pressure if I've been diagnosed with a secondary condition, just to make sure that my numbers are staying stable. All right, another one, very well known, fact, true. It is something that happens. It's called white coat syndrome. It's real. And then think about this. Have you ever had your blood pressure read higher at the doctor's office than it usually does when you're at home? And so why is that? All you did was step into the doctor's office. In 2017, a study in the Journal of Hypertension found that up to 30% of people with increased blood pressure have disordinate in office and out of office blood pressure. So this condition is known as white coat hypertension. And it could be due to so many different factors, including feeling stressed in the presence of healthcare providers. It's not a trivial thing. It is real. Doesn't mean you're scared. It doesn't mean that you feel anything. It's just the way that your body happens to be reacting. But white coat hypertension is linked to a higher risk of heart attack or stroke or cardiovascular disease. So what you can do for that, I would think, based on all the things we learn here all the time at Aortic Hope, would be grounding techniques. If you know this is something you suffer from, maybe go into ask if you can be put back into the exam room a few minutes earlier and ground yourself and take some cleansing breaths and focus on your five senses. Try to listen for a sound. Try to smell something that's in the room. Maybe bring gum or a mint and try to have a taste. Visually look around the room for the patient awareness posters in your exam rooms that tell everybody about aortic hope. Use your five senses. Touch the paper that lines the exam bed, or feel the coldness of the metal edging the chair that you're sitting in. By the time you've done all of that, your blood pressure has come down, because that's what grounding does. And if your blood pressure does run high Ask them to take it at the end of the appointment. They will come back in. I was recently at an urgent care and I could not believe what they said my blood pressure was when I came in. I knew it was so inaccurate. And I have to tell them to take it in my right arm, which typically runs higher than the left. So he tried to take it constant over and over and over again, manual. He did not know what he was listening to. So as soon as I went back into the room, I'm like, I'm not trying to throw somebody under the bus, but that's not my blood pressure. I don't have white coat syndrome. He just did not take it correctly. And they took it and it was much better. So advocate for yourself. But if you are interested in learning some more information or more details, there is a link so you can click on the article and read more about it. That's your Medical Monday. A lot of info. I know. It's a lot to take in.
The white coat
But
syndrome thing is
yeah.
very weird for me.
Do you have
Just
that?
no, to hear that that's a thing that is now quantifiable, that they can be like, oh no, this guy gets high blood pressure when he's here.
Yeah.
That's
Listen, when people have to become rated for their life insurance policies, then they send a nurse out to your home to do a blood draw, to do your vitals. I know people that lay on the kitchen floor just to relax themselves, and then they say, okay, here's my arm, take my blood pressure, because they know they're better when they're lying down. And it calms them. They don't want to just be sitting at their kitchen table freaking out like, what's it going to say? And are you going to rate me high and charge me a lot of money? They position themselves in a way that they know they can just go deep in and reduce that blood pressure. But listen, it's not something that changes it instantly. You're better off go for 3 separate pressures, beginning, during, end, average it out. I used to try to beat the game. When I was first put on blood pressure meds and I would forget to take them, I would be in the doctor's office. This is way before any of this stuff with aortic open stuff happened. And I would start breathing really slowly. And when he would take the pressure, I would kind of hold my breath and like really take it down slow, thinking that that was reducing the pressure. It was just reducing heart rate, but the pressure was still not great. It's one of those things you can't run away from if you truly have a pressure issue. So,
very
like,
interesting.
I know, but and white coat is real. All right, let's move on to Topic Tuesday. We're going to talk about blood thinners. Blood thinners. Many of you are on them. Many of you are on many different types and may not even realize what you take as a blood thinner. And many of you are going to temporarily get blood thinners if you have a medical procedure. So let's talk about this. But WebMD shares that blood thinners are medicines that help blood flow smoothly through your veins and arteries. That's what a blood thinner does. Okay. They keep blood clots from forming or from getting any bigger. And in our community, many use them after receiving a mechanical valve. Okay, all of you receive them after using a mechanical valve or for an underlying medical condition. These drugs help protect against heart attacks and strokes, but they also come with risks. For example, they'll cause you to bleed a little bit more than usual if you cut yourself. But there's 2 different types of blood thinners, and I've been recently seeing people talk about having to go on one versus the other and are they going to like bleed out. So we have anticoagulants, and an anticoagulant actually keeps your blood from clotting altogether or turning into solid clumps of cells that stick together. That's an anticoagulant. Now an antiplatelet targets tiny particles in the blood called platelets. It's not as intense as an anticoagulant. So here's some of the anticoagulants that you might take. I'm going to butcher the majority of the names and I'm going to read the brand. So Eliquis. Eliquis is one that we typically hear people take when they have AFib, and it does not stop AFib, which is an irregular heartbeat. It stops the chances of having a blood clot that might lead to a stroke because of a fast, irregular heartbeat. I don't understand all the mechanics, and I don't need to because I'm not a doctor, but Eliquis is one of these names. Eliquis and an anticoagulant would be one of those drugs that if you cut yourself, you might need a little extra pressure. Okay, it's not the end of the world, but you definitely need to tell people that you're on an anticoagulant, whether it's Eliquis, Pradaxa, Lovenox is another well-known name. Heparin is another name. Lovenox and heparin are in injections we typically might have when we're laying around in recovery because we don't want clots to form from inactivity after surgery. So they just give them to you in your tummy so that keeps everything flowing. Xarelto is another one similar to Eliquis that I've heard that people then take in pill form at home. So, I wouldn't say that you have to be scared, but I would ask questions of your physician. I'd want to know more about this, right? Antiplatelet. Oh, and then the other well-known one is warfarin, or known as Coumadin, or Jantivin. So that is typically the anticoagulant that's given if you have a um, mechanical valve. Okay, so and I still think that all of these are going to operate a little differently, and I'm thinking that, don't know it, only because you don't see people on AFib taking Lovenox. That's not what's typically given. You really hear the Xarelto or the Eliquis. So there must be some difference in these drugs. But common antiplatelets, which would be then your step down, would be aspirin, could be Plavix, could be Brilinta. These are some of the names of things that I've heard of before. Aspirin at a higher quantity. We're not talking one baby aspirin at 81 milligrams. And just that, also Advil, ibuprofen can thin out your blood a little bit. But so you that's why when you call 911 and you think you're having a problem, they're going to tell you to take aspirin to thin out the blood enough that it keeps you somewhat protected in case you are like having a heart attack or there's something else going on. But I've taken now, I was on Plavix for a long time, never had a bleeding issue whatsoever. And I personally just started Eliquis and I'm not having a bleeding issue at all still. So just a little pressure. It's not anything that I'm super like nervous or scared of now that I understand it more. But if you want to learn more about how these blood thinners work, antiplatelets versus anticoagulants, and all of the potential side effects, you can click the link to the article in this topic Tuesday. And you should talk to your physicians because if this is going to be a game plan, ask questions. Ask questions. There's a lot of different drugs, just like there are a lot of different beta blockers and ARBs and angiotensin receptor blockers is what an ARB is. One may not be the right one, but maybe another one is. So these are all good reasons to have these conversations with your physicians. Hence Topic Tuesday. There you go.
That's a good one. And also, um, I guess manage expectations when you're changing your prescription.
Yeah.
That's not next day change. It can run
Yeah,
up
no,
to
it
two
takes a little bit.
weeks. Yeah.
Yep. Now I will tell you one of the things I learned is if you're on Plavix and you're going to have a medical procedure, you have to be off of it about 7 days. Sometimes they'll let you go 3 or 4, but it's typically 7 for surgery. Whereas Eliquis, it's only 2.
That's very
So that's
interesting.
a shorter lifespan. Mm-hmm.
It's also interesting because when we hear people in the support groups, we tell them, "Oh, you're changing your medication. You know, don't be too hard on yourself for the next 2 weeks." So if it's
Yeah.
going to take 7 days for one to go out while the other one's kind of catching up,
Yeah.
yeah, that's
Right.
interesting.
Yeah. All right. Our next post was welcoming Sandra Leiden. She is joining the Aortic Hope team. Her focus is actually going to be as our grants administrator. Requesting and being approved for grants are very important as they assist Aortic Hope in being able to provide initiatives such as Aortic Dissection, the Patient Guide, podcasts, and so much more. And this is a few words from Sandra. Thank you for this opportunity. I grew up in Southern California and attended college in New Mexico. After several years in a few additional states, my family and I ultimately landed in Nebraska. My husband and I have 3 children, teenage daughters, and an adult son. I have 13 years of experience employed in the nonprofit world, and I'm thrilled to volunteer with Aortic Hope. My ascending thoracic aneurysm was found incidentally on a CT scan in 2020. When I feel overwhelmed by the limbo of the watch and wait, I often find reassurance in reading the shared experiences and stories from individuals in the Aortic Hope community. Aortic Hope's live events like Q&A with a doctor are grounding and help me remember how lucky I am that my aneurysm was found in the first place and can be followed by medical professionals. I love hearing that. That's the goal of it. So please take a minute and welcome Sandra.
Welcome,
There's Sandra.
Sandra.
All right, guess
And
what? We
hold
haven't,
on, hold
yeah,
on. I want to share
yeah,
thoughts. So, like, we were on the radio show the other day, and that lady was in Watch and Wait, and she
yep,
thought that this new information was very triggering. And
yep,
I mean, it's It's like you said after the radio show portion was over and you started talking to her a little bit more directly, and you were just like, you're in the right place. You've been
Mm-hmm.
found. You're being monitored. This may never grow again. You cannot
Mm-hmm.
dwell on this. Just know that you're doing the best thing that you can for you. Take your medications, lay off of extreme activities. This can go on for decades. And
Well,
she
right.
was already kind of in the throes of
Yeah.
the anxiety, and that
Oh,
was
yeah.
unfortunate.
And it's crazy to me when we get a scan and it says you have gallstones, and you would know because you've had an issue. You have gallstones, and some of them are pretty big, and you should consider taking out your gallbladder. Nobody really freaks out because if they don't feel anything, they are like, all right, whatever, it's a gallbladder. Except if you have these stones get stuck in your bile duct. First of all, your bile duct could potentially rupture, depends on how big the stone is. It could tear, it could make you become sepsis. So people just take for granted how bad a gallbladder can get and what it can do to your body. Same thing with an appendix. If you've been having pain, but then you don't have pain and you dismiss it, but you don't realize that this appendix is growing and growing and has inflammation, you don't want to wait until it ruptures. And now you've got a world of hurt going inside your body. I know it's different, but think of things sometimes like that. You now know there's a something. There's nothing to do about it right now. We're just going to keep our eye on it. You're not feeling it. And it's always fascinating to me the people that all of a sudden, the day that they've been diagnosed, they start feeling shortness of breath, they're coughing, they can't swallow, I can't get food down. It's it's all here. If you can't get food down, it's something totally unrelated to a 4.1 aneurysm. It's could be you have a problem with your esophagus, but it's not your aneurysm. I can't breathe, I'm dizzy. Well, it's not your aneurysm. It could be something else like anxiety or a side effect to medication. So knowing that you have something that now people can monitor and adjust medications and help you live your very best life as safely as possible, to me is such a win-win than just never knowing. And that's what I tried to get across to her is go out into a crowded place and look around. There's at least 10 people in that room that have an aneurysm and they probably don't know it. And they're just living their life, smoking or drinking or lifting heavy weights or being as healthy as conceivably possible or not doing much at all and chasing around kids or working a daily life. They're just living because they don't even know they have it. And you're in a much better position because you know that you do. That's kind of how I look at things with people who have been diagnosed with an aneurysm.
I agree.
The godsend.
I
Yeah.
think it's the right thing to be. Get monitored, get your blood pressure medication set up, start preparing for
Yep. Yeah.
what that looks like. Again, it
Yeah.
grows once and then it never grows again. Best case scenario.
Exactly. And that could happen. All right, but we're welcoming Sandra, and we have another one to welcome. This one's pretty fun. Scott Paulson. Look at Scott. To me, he looks like an odd artist. He reminds me of what's his name? Ross. Jim,
What?
the artist.
Bob
Can't think.
Ross?
Bob. Jim. Bob. Yes. So Scott's more than just a community member and a survivor, as you're going to find out more in a few minutes. He's actually going to be focusing his time with us as a community liaison and assist members with a variety of different aspects as newcomers in the aortic disease world. Here's some words from Scott. So Scott and his wife Rosie are the owners of S&R Services. Look, it's their initials. It's their own company. It's an insurance brokerage firm in Zephyr Hills, Zephyr Hills, Florida. Their area of expertise is assisting individuals in understanding and selecting the most suitable Medicare coverage. And they are actually going to do a live event with us in June or July as we get closer to open enrollment for Medicare, because every day more and more people in the community are getting approved for disability, and that would include having the opportunity to sign up for Medicare. So what a blessing to be able to have them and have them educate and help the community. During the month of December, you ready for this? Scott undergoes a remarkable transformation as he assumes the role of, look, it's Santa Claus, but we all know it's not the real Santa Claus. He's one of Santa Claus's helpers because Santa Claus can't be everywhere at the same time. But he does a remarkable transformation. And I've seen the photo. and it is fabulous. He spreads the joy of the holiday season to both children and adults. And the evening of October 1st, 2023, Scott's life took an unexpected turn. He visited the emergency room due to mild discomfort in his chest. To his surprise, he was diagnosed with a type A aortic dissection, but within hours of receiving this life threatening diagnosis, he was undergoing preparation for open heart surgery. Scott understands the, Scott emphasizes the utmost importance of being attuned to one's body and recognizing the warning signs of heart disease or any condition that demands immediate medical attention. He stresses that it's always better to err on the side of caution and seek medical assistance promptly. This experience prompted Scott to raise awareness about the unique nature of each individual's health. He aims to collaborate with Aortic Help to convey the message that even mild discomfort in the chest can be as potentially life-threatening as excruciating pain experienced by others. He also wants to ensure that everyone whose life is affected by aortic disease knows that they are not alone and that there are many people who are going through the same thing and care. So please take a minute and welcome Scott, aka Santa Claus.
Welcome, Scott. I'm looking forward to April 6th when we go live with his story. Yes.
Wonderful.
April 6th, 7 p.m.
I'm going to add that to our list of events when I write it down real quick. 7 p.m., huh?
Yeah.
All right.
I think we get the most views on Saturday and Sunday at 7. And then throughout the work week, it tends to trend between 3:30 and 6:30.
Interesting.
We get a little heat map through YouTube.
Okay, very interesting. Well, he sent me a picture of himself, and I said to him, I could see us having a meetup, various places around the holiday season, and sending Scott to go meet survivors and have him sit on his lap, take pictures.
Oh wow,
that would be great, right? Okay, let's move on. This is another exciting thing. So, like 2 weeks ago, we launched Aortic Hope Canadian private forum on Facebook. So it's just like our own private forum. You have to answer a few screening questions to join, but this is specifically and only designated for our Canadians because while support is universal, the information that goes on in the medical communities is very different in Canada. So they are really looking for a place to have those types of conversations that really pertain to them and show some articles and share some information, which I have to tell you is very, very challenging. I tried to contribute and was hunting for some articles from Canada, and there's just really not a lot there. I don't know. I don't know that I want to know, but I don't understand. I wanted to be helpful, and I couldn't find anything that was from Canada. So I don't know. I'm going to learn more. I'm going to learn more about it. But what we did is we've now started the Aortic Hope Canadian Support Group meeting. So this is for Canadians. Okay. It's the first Wednesday of every month at 7 p.m. And you basically are joining the same way that you do for all of our other support group meetings. There is a link. You only have to register once. You'll be notified of all of your meetings. You'll be notified about our hangouts. Gives you a chance to participate in whatever you'd like. And just because you're signed up for the Canadian doesn't mean you can't attend the general support group meetings here. I just say here because it's global. It's not specific to the US. It's just open. And if you're a caregiver, there is not a specific caregiver one for Canada as of yet. We'll see if that becomes a need. We'll make it happen. So if you're part of the Canadian support group, feel free to join the caregiver one if you are a caregiver. You can join the other. I'm just going to call it global support group meeting. And this is actually going to be moderated by two survivors that we love, who we've already introduced to you the last week prior, and that's Martha Morris and Velda McKenzie. So they have been participants for a long time in our meetups, in our hangouts, in our live events, and in our support group meetings. And I feel so excited and honored to have them lead the charge in this support group meeting. And if you're going to join, we do strongly recommend you download Microsoft Teams for your best experience. So that is that. And that starts the first Wednesday at 7 p.m. in April. So exciting.
I should know that. Thank you for letting me know that.
Okay. You knew. You forgot. You gave me the link. Yeah. People are signing up. I see it. It's exciting. All right. We're moving on to Think Aorta Thursday. Look at this. This is the graphic that you'll get if you share your patient success story. Let's talk about what that means. So, Think Aorta is looking for patients who have shared their medical history with their family, amongst themselves, and their physicians. And we want to know if you've had your families tested, whether it's diagnostically or genetically. Hey, look, if you haven't done anything, I'm kind of curious to know why. So share that story too. But there's a link here. You're going to fill out the form. Someone will be in touch with you to garner that story and to get a picture of your family so we can share this graphic and that you can share the graphic across your social media channels. The idea behind this is Think Aorta, Think Family. This is a hashtag. It's an initiative created by Think Aorta US that's now being implemented globally. And the idea is we want patients who have aortic disease to sit down with their immediate family members. So it's their children, their siblings, their parents, and to let's talk about this. Let's kind of do a run through. Did anybody have an aneurysm, even if it was brain in our family? Anybody that you know, grandparent, whatever? Does anybody else have any other aneurysms anywhere? How about heart disease, history of stroke, things of that nature? Did somebody die suddenly and we didn't do an autopsy and we just chalked it up to a massive heart attack because it might not have been? So let's talk about these things and let's share them with the physicians. And now what? So the now what can be that you decided to have genetic testing to see what if and what the cause might be in yourself. And just because you don't hear anything now doesn't mean in 6 years you won't, because the number of aortopathy uh, genes that are added to the panel go up about every 6 or 7 years. Also, if you're not going to have your family members genetically tested, did you at least send them for a CAT scan? And if not a CAT scan, did you at least send them for an echo? And if something was enlarged in the echo, have you sent them for an MRI to do the entire aorta? Remember, it's one organ now. If you have something on the top end, doesn't mean you won't have something on the bottom end, and vice versa. These are success stories because you're doing everything you can to determine who is at possible risk and set up a monitoring system, follow up until the point of any kind of diagnosis, and then you move through to treatment. So we want to hear from you. We want the entire community, Aortic Hope's community, Think Aorta's community, everybody to know what you're doing because this is important stuff. Aortic dissections are rare, but aortic disease is much more common than you think. So when you're in doubt, you want to go check it out. And that was our Thursday. All right. Feel Good Friday. Opening day. Right around the corner, right? Isn't it like next week?
Oh, I wish I knew.
2 weeks. I guess I always assumed opening day is the same for every single person, but we have these amazing limited edition baseball logos. Look how we turned our logo, and it has a baseball cap and a baseball bat and a baseball glove and a baseball head. These colors happen to be in the colors for the Orioles because we are having a fundraiser night out with the Orioles on April 12th, which we sold out tickets for. So we're hoping a lot of people get a chance to grab these shirts. We've been running specials. I think free shipping ends today. You just click the redeem button on our Hope Shop through Spreadshop. And we're going to follow it up with another sale right behind it because it would be great to see just a big sea of orange, all these logos and shirts in the section that we have where we've sold over 80 tickets. So it's very exciting. But if you don't see your t-shirt, your team's colors, just shoot us an email at info@aorticope.org and give us an idea what they are. We will do our very best to try to see if we can create a logo and put it on a shirt color for you, for your team. So that was our Feel Good Friday. No,
Are you
boy,
going to this thing? Are you gonna
I'm
make it?
having surgery on the 8th, so I
Oh,
can't
that's
go. But
right.
I'm going to
See,
go to the
so it
one
is
in
right around the corner.
It is. And I am going to go to the next fundraiser in August, and we may even add a third day. So I'm hoping to go. I like to go a lot. One of our board members has season tickets, so I do get to go when it's not her husband or son going. I'll snag a ticket. All right, we're back into the Think Aorta Think Family. This is what we were kind of just talking about. This is the Think Aorta Think Family campaign. And So Think Aorta US is this amazing nonprofit organization whose focus is to help increase diagnosis time by educating medical professionals and first responders to think aorta when faced with unexplained chest pain in a patient. It's two simple words. It's very easy. And we are really working with some great med students who are spreading this campaign like wildfire right now because it is easy, two separate words that relate to a medical condition. Their initiative, Think Aorta, Think Family, is so much more than a catchy phrase or hashtag. And this is kind of what we talked about, just giving you another version of this. It's your family's medical health history. It's just so important. I can't say it enough. When you think about your own health, you need to think about others' health. And so while the weather is getting nice and everybody might start spending more time with your family, just ask a question, bring a pad of paper and just ask. Okay. So again, has anybody died suddenly? Cancer, diabetes, stroke, heart disease, prior aneurysms. You want to get that information noted and you want to get the conversation started. This way, in the event of an emergency, you can provide this information to first responders and it helps them kind of put together a better visual, put the pieces of the puzzle together when presenting your information when they arrive at the receiving hospital. So there we go. There's a link here to the CDC. They actually have a form where it can help you capture all this information. It's pretty interesting. You should check out the form, print it off, keep it in the wallet, keep it with everything else as well, and have these conversations with parents, sibling, grandchildren, and your own children. And that is that for that. All right. Rolling to the Survivor Series with Eva Peterson, everybody. Eva Peterson. Such her story when I read through this, it's very reminiscent of my own because she felt this feeling in her throat like something was stuck and I felt like this pop in my neck. And so it wasn't this ripping, tearing, heinous, horrible, life-altering pain. It was just this is weird and I've never felt this before and it doesn't feel good and it's enough to make the brain say this is we need to pay attention. And she did because she got 911 and got the paramedics to arrive. And, they were pretty convinced she was having a coronary blood clot, but it turned out she was having an aortic dissection. So this is her story about what happened. And it seems like at 57 years old, I didn't really see anything that said she had family history, but she was a nurse at the local hospital where she was employed. This is where she went. And I think as a nurse, you kind of know when things are not right. And despite not having a medical history, they were able to really make the right decisions for her and get her into that CT scan and ultrasound and have it all confirmed. So read this story. This is one of these, this is the story that goes well. This is a story of somebody who's in tune with their body, makes the call, and the hospital does the right follow-up. But thank you. Thank you for signing up to be a survivor, to be featured in this series. Look, we want to hear from everybody. We want all of your stories because these stories really validate those that are listening. And it also creates questions for us to take back to our own physicians. And I guarantee you're going to find it therapeutic. You can do a written story like you see here. You can also reach out and pre-record your story like I'm doing today, or you can go live like I normally do and take some questions from the community that are watching about your story. And we just know we would love to hear from you, survivor, caregiver, or if you happen to lose a loved one to aortic disease, we want to know about that as well. Their story is very important. Okay, let's go on to our events. I'm just starting. I think I got all of this pretty much updated. There's just a couple things because I got tired. So anything in black does not have the link really attached to it right now or the correct link. Reds are ready to go. This is for April, but let's just finish up May and next week we'll talk about April. All right. So we have got on Sunday, no, actually, we're missing a hangout here, right? No, this was Sunday. No, it's to the 25th. I don't even know what day it is.
You're
Sorry.
doing so good.
Blah. This Wednesday, last Wednesday of every month, we have our evening support group meeting at 7 p.m. Eastern. So again, join a support group meeting. You're going to be notified of what we're doing and what we're talking about. I don't believe we have a guest speaker, but we may have guest speakers that I'm not even aware of that start popping in to the meetings because we're inviting physicians left and right. And we're telling them, if you can come, just show up. Now, if I know ahead of time, I will definitely let you know, because that's a support group meeting you want to attend, because you're talking small group setting. It's a great opportunity for you to ask some one-on-one questions. The next greatest moment we have with that is our Ask a Doctor events, and then of course our live events. But as support group meetings, look, it's kind of a surprise. You never know who the is going to be, but that's happening on Wednesday, the 27th. Then we have our hangouts on Thursday at 2 p.m. And those are not support group meetings. They're just a lot of fun. And then on Sunday, we wrap up the month with Qigong at 11 a.m. Eastern with Kevin Songer. So that's our events. And we're still putting together events for April. And ta-da, ta-da,
Do you
ta-da.
happen to have the inside track on the doctor or pharmacology's next visit?
I can just send her a message and I can tell you when we can
Oh,
have a next
I didn't
visit.
remember if you already had her in the schedule.
No,
She is
I
a
don't
fan
yet.
favorite. I have to say, she's a fan
Yeah.
favorite. Everybody has a million questions about their medications,
Yep.
and she's like a little robot. This is this. This is that. This is how this works. This is how that works. And everybody loves that about her. She's great. So yeah,
Well, you know what?
bring her
If I
on.
can if I can get it in April, despite that I can't do it at all, we'll get somebody else to host it. I think that would be great. I know that in May we're going live virtual reality through my aorta. And we have a new guest, a new doctor, Kyle Udaly out of University of Alabama. He'll be joining us in May. June, we are interviewing Dr. Jita Hajar. She is also part of an advisory board of the Loie Dietz Foundation in Canada. So that will be our first Canadian guest speaker, talking a little bit about what goes on in the Canadian healthcare. why, why is it going to be so different? And we need to learn these differences. It makes my eyes go wide. We're going to talk about some of the things that's going on over there, but I will talk to Dr. Watson and see if I can get her to join us as well. We've got Cinco de Mayo bingo coming up early in May. It's early this year, so it is before. In case you guys just want to like get that on your calendar, because that's always a good time. That is on May 2nd. May 2nd, because the 5th is on a Sunday and I am going to be in vacation. So we're going
Big
to do it
hat
on the
day.
2nd. Huh?
Big hat day
Big hat day.
for Cinco de Mayo. Wear big hats
Yeah.
for the bingo, or little hats.
Um, or little hats that you can't really see. I always like to wear a little teeny hat. There you go. You can see it better. My little sombrero. I had it backwards. There it is.
You
There
know
it is.
what? You've
Hmm?
never worn that the right way. I
I
never
think I've
knew it was
always
a
worn it.
sombrero. Yeah, you've always worn it with the feathers and ribbons forward.
There it is.
Hilarious.
Okay. All right. Well, that's all we've got for this week. And leave your comments. Even though it's not live, I'd love to still hear from all of you. We will you got to pay attention and join, because we're going to start rocking and rolling with some more contests, giveaway of magnets, giveaway of decals. I've got a lot of stuff. I've got stress balls and I've got jar openers and I've got keychains that you can put your pills in, but you got to join. So when we're back to doing this live, which probably will be in a couple weeks, we're going to do that. So click like, click subscribe, click the bell, share this. People will get some information that's important to them out of this, and they're going to want to know about it. And we appreciate you being here. And sayonara till the next one. I will actually see all of you guys next Monday at 3 p.m. Have a great rest of your week. Thanks again. Bye.